in the soft tissue, in such changes in the soft tissues of the orbit, the formation of an anophthalmic stump by traditional methods will be insufficient. I want to tell you the story of this young woman. Before contacting us, she was treated in other clinic in other country. We have no documents regarding her treatment. All information are based on the words of the patient. For many years, she suffered from secondary painful glaucoma, but for fear of losing one eye, she didn't agree to do operation. This led to an increase in the size of the eyeball. When the eyeball was enlarged to such a size that the palpebral fissure don't close, she agreed to enucleation. In a certificate issued to her at the clinic, we find information that a standard operation was performed, which is performed for the enucleation of blind eye of normal or slightly reduced size, a visceral enucleation using a 20 millimeters implant. When it became possible, an individual eye prosthesis was made, but the patient was not happy with the result. As you can see, it was not possible to achieve a symmetrical position of the prosthesis and the palpebral fissure. After a while, they tried to fix the problem by increasing the volume of the eye prosthesis. Failure again. Another try, introduction of a filler, hyaluronic acid, into the area of the orbit palpebral fold. The filler was decisioned under the skin of the upper eyelid. Again, the patient is unhappy. In this mood, she turned to our clinic. First of all, we removed hyaluronic acid by injecting hyaluronic dust into this zone, and then made the computer tomography of the orbit. After studying the medical history and orbital tomography images, we realized that the main mistake was that the operation was performed without taking into account the change that occurred in the orbital tissues under the influence of the large eyeball. That is, the volume of the used implant was insufficient. We can do simple calculation. The volume of healthy eyeball is approximately 7 cubic centimeters. With the development of ophthalmos, its volume can reach 9 to 10 cubic centimeters. The implant was diameter of 20 millimeters, has a volume of 2.4 to 4.2 cubic centimeters. A visceral enucleation was performed, where the scleral tissue is preserved. That's about 2 cubic centimeters more. 4.2 plus 2 equals 6.2. There is still a log of 2.5 to 3 cubic centimeters of volume, which the eye prosthesis must fill. But in our opinion, the eye prosthesis of such large volume and size doesn't give the desired cosmetic result. We discussed this problem with the patient and decided that it was necessary to perform an operation to replenish the missing volume of the orbital tissue. The operation was performed using a transconjunctival approach through the lower eyelid. The plates of polytetrafluoroethylene was a total volume of about 3 to 3.5 cubic centimeters were installed in the region of the lower wall of the orbit. We were able to reposition the previous implanted orbital implant. In this picture, you can see how the implant changed his position. We also corrected the position of the orbital palpebral fold of the upper eyelid and achieved symmetrical position of the prosthesis in the comparison with the healthy eye in the frontal plane. But the problem of pseudoptosis of the upper eyelid and deformity of the lower eyelid have not yet been resolved. We performed an operation to shorten the Mueller muscle, which in our opinion was very effective. This case once again demonstrates how important it is to establish close cooperation between the oculoplastic surgeon and the ocularist. Thank you for your attention.